What is the best way to explain stomach cancer types, diffuse versus intestinal? Understanding stomach cancer can seem complicated, but breaking it down into two main types makes it clearer. The two types are called intestinal and diffuse, and they develop differently, look different under the microscope, and behave differently in the body. The intestinal type of stomach cancer is named because it resembles cancers found in the intestines. It usually starts with long-term inflammation caused by infection with bacteria called Helicobacter pylori. Over time, this inflammation can cause changes in the stomach lining, like precancerous growths known as dysplasia or adenomas. These changes can slowly turn into cancer. Intestinal-type cancers tend to form gland-like structures and grow in an organized way. They are more common in certain regions and are often linked to diet and environmental factors. The diffuse type is quite different. Instead of forming clear structures, the cancer cells spread out in a scattered, infiltrative pattern. This causes the stomach wall to become thick and rigid, but it can be harder to detect early. The main reason for this pattern is the loss of a protein called E-cadherin, which normally helps cells stick together. When this protein is missing, cells break apart and spread more easily. Diffuse cancers tend to occur in younger people and can run in families. They also grow and spread faster than intestinal cancers, making them more difficult to treat. Both types are recognized by health authorities, and while they are managed in similar ways, their differences are important for understanding prognosis and treatment. Generally, intestinal-type cancers have a better outlook because they tend to grow more slowly and are detected earlier. Diffuse types are more aggressive and often diagnosed at a later stage, which can make treatment more challenging. To explain this simply, think of intestinal type as a garden with organized patches of growth, like neat rows of plants. Diffuse type is like weeds spreading everywhere, making it harder to control. Both are serious, but they start and spread differently, which influences how doctors approach treatment and what patients can expect. This explanation helps clarify the key differences between diffuse and intestinal stomach cancer, providing a clear, accurate picture based on current medical understanding. Always remember, if you or someone you know has concerns about stomach cancer, it is best to consult a healthcare professional for personalized advice and diagnosis.